This is going to be a general update on, first of all, why I chopped my very long hair off. You probably saw that on previous videos, that my hair was very long. But unfortunately, this disease has driven me to chop off my hair. I'm not overly thrilled about it, but we'll get into that. Some medication changes and how I'm doing going back on the Benlysta and with this new medication added to kind of combat these side effects of the Benlysta. Let's get into it. Hey loves, little spoiler alert. So I am uploading a video, my lupus story part 2, at about 6 p.m. Saturday evening, this coming Saturday. So this is going to be about this other part of the immune system that can become dysfunctional, and little is known about it, never mind by patients, but by even providers. So getting this other diagnosis changed my life completely in such a dramatic way. And it's something I think you should know about because it kind of goes hand in hand with other autoimmune diseases and anything in regards to a dysfunctional immune system. So back to the video. Okay, so with the seborrheic dermatitis, I just pretty much took off as much as I can stand. This is as far as I got. Because I wanted to grow back healthier. I found the supplement, finally came in about a week and a half ago. So I'm taking the caprylic acid and omega-3 fish oil and a vitamin D3 together daily. And I'm just doing everything. Like I've watched hours of videos of like hair gurus and dermatologists. I've bought like silk scrunchies and silk pillowcases, and I just can't even. I'm doing everything I can to get my hair to grow back as healthy as possible. I'm not too upset about this length. I'm sure you saw in older videos I have very long hair. Because my hair does grow very quickly, I just want it to grow back healthy. I'm sure you probably couldn't really see in the video how much mid-shaft breakage and flyaways and everything that there actually is or was. And it's just all the way up in here, like close to the roots and then the mid-shaft and everything. It wasn't a good look. So I really do appreciate the comments on that video where I was talking about the seborrheic dermatitis and how it has wrecked my hair. You guys were really sweet about that, and it was definitely appreciated. But yeah, this was all basically to get it to grow back as healthy as possible. And within only a couple of days, this has worked really well. Now I've called, that's the caprylic acid, by the way. I called OptumRx, spoke to the Benlysta pharmacist that they have, and they told me that it shouldn't interact with Benlysta, but again, it's a supplement. So, definitely ask your rheumatologist before you take anything. We're on some serious drugs, right? And you never know. So that's the deal with the hair situation. Now, I did notice literally within a couple of days, there's no more of those red, like boils almost. They kind of looked like that. There's really the flakiness on the scalp is 90% gone. I have some itching here and there. It's really not that bad. It's not as bad as it was. So it's definitely going away. And I've been taking this, it says to take it twice a day, which I have been doing religiously. And this is the same ingredient that is in coconut oil. It is a medium chain triglyceride. So that's that. If you're having trouble with your scalp this can happen, I think, from the immune suppressants, because it definitely happened to me after taking Benlysta and going back on it. It just started flaring up really bad. So yeah, I would definitely talk to your doctor and try this if you're having that issue. So the other thing, my appetite was so bad on the mycophenolate, or you might be taking brand name Cellcept, that I called my doctor and insisted that we switch back to brand name Imuran, or the generic is azathioprine. So what's disturbing me is that it's been over 2 weeks, I believe, that I've been off the mycophenolate and back on the azathioprine, and I still don't really have my appetite back. It's not as bad as it was, but these medications really mess you up, and they have some serious consequences. And I think the thing is, we don't even realize that some of these consequences can be rather permanent. I'm not saying I'm never going to get my appetite back. I'm not paranoid. I'm sure it's just going to take time. What I am saying, this leads me into my next point. I wish that there was a little bit more enthusiasm about the stem cell treatment situation. I'm just going to come out and say it. So I'm going to be, since I didn't really get any feedback from that, I don't really know what's up with that. I kind of thought that there would be more, at least curiosity towards this issue, because I don't know about you guys, but I'm sick of these cytotoxic drugs that, I'm having to do this stuff and cut my, I have no appetite. I'm just so sick of it. These drugs have really serious side effects, and I'm tired of it. So what I want to do, and I'm hoping this will pique more interest, I'm going to email Swiss Medica, because I keep getting emails from this stem cell clinic in Europe, to see if they'll let me do an interview with the physician there, since they wanted to do a Zoom call with me anyway. I'm just going to interview them, see if they'll be up for that, and ask them all the questions that I think us as lupus patients would have. And again, I hope that you guys can give me some insight into maybe some questions that you might have that maybe I'm not thinking of. So please do that, because I am definitely going to be seeing if they will let me interview them. And I'll be videoing that whole situation. And I'll keep you guys informed if they agree or not. So that's that. The fallout, the initial fallout that is inevitable, kind of, for most of us when you start Imuran. I remember this from the first time and the second time I was on it. Yeah, my hair's been falling out more than I would like, but it's better than not having an appetite, and I choose to be healthier versus vanity. So it's just hair, it grows back. Eventually it levels out and your hair will stop falling out on Imuran for most of us. And if that's not the situation from you, I'm really sorry that you're going through that. And I hope you find a way to deal with that, or a different medication that maybe won't have that side effect for you. So I've noticed we have some new subscribers here, and we're very happy to have you. If there's anything you would like to see or for me to do a video on that I'm not covering, please let me know. Let me know in the comment section, and I will definitely do my best. The last thing, the Benlysta. So there was so long in between the first injection. Now, I know this is a little confusing, but I had taken Benlysta twice previously, had a negative reaction. It was more of a side effect that it caused mood problems, basically. So it worked wonderfully for my lupus. So this third time around, since I did the Cephanilo infusions, and that had the same mood side effect that Benlysta did, but it didn't work well for my lupus at all. This is my third time trying Benlysta, but we've added a mood stabilizing medication to mitigate that side effect. That has been working beautifully. I think that that's been fine, but I do have to say it took a good few injections of the Benlysta to start having that level of mood problem and severe depression and everything. And there was such a large amount of time between my first injection when I got sick and probably didn't explain this, but it was even longer than that because I had to, this one, I had to take antibiotics, and then I had to have a skin lesion biopsied. It was fine. There was no cancer. It was just something benign. But I had to have a skin lesion removed and biopsied, and so I had to let that wound heal. So it was like almost 3 weeks before I was able to do my second injection. Hi, Nana. Okay, girl. So, you're adorable. So, my second injection will be this weekend. I'm going to film the injection. And yeah, I'm not feeling great. I'm not feeling myself. I had the change in the anti-rejection drug from the mycophenolate to the azathioprine. And, you know, I'm not on the Benlysta long enough to really be getting the benefit from it yet. So that's where I'm at. I'll keep you guys updated on that. But also, I'm doing it every 2 weeks. That was the other thing that changed from the last 2 times I took Benlysta instead of every week. So it's going to take even longer for me to feel better now. But I can't wait, and I'm hopeful. I know that this medication, it did work. So I'm just doing my best to be patient, and I know that that's really hard. It's really hard when you haven't found the medication that works for you. I really feel like I need to be patient because I remember what it was like when we didn't even know what was wrong with me. It took years to figure it out, and then it took like 6 years to figure out the combination of like medications that were going to work for me with the lupus. So, I mean, I can imagine someone that hasn't even gotten to this point yet of managing their disease. So I'm not going to sit here, no, I'm so upset. Like, I know I'm going to be feeling better soon. I really, at this point, after everything I've been through, just feel for the people in our situation that haven't figured that out yet. I really do. It was very difficult. I'm almost tearing up just thinking about it. It was horrible. So I hope that you're not in that situation. And if you are, I really will be praying for you that they figure it out. Anyway, that's my update, guys. So I hope you're all feeling okay and you have a good holiday season. And thank you for watching this video to the end. I really appreciate all my current subscribers. I love you guys. Thank you for all your likes and shares and support. I really do appreciate it. And all the new subscribers that are here. Thank you for joining our lupus family here, and happy holidays, guys.